stay at home in order to flatten the curve. Right now, we don't know where our curve is, which speaks to what Dr. Cantrell alluded to. Within the next week, it's going to be very, very meaningful in terms of the tests, because they've been ramped up, and the results that we stand to get, and therefore the positives that we stand to gain. And what we know and what we expect over the next week going into the following week, this is a very critical moment in not only the city of New Orleans, but through the region. And leadership is collaborating, leadership is supporting one another, and leadership is galvanized in a way that we haven't seen as it relates to this virus. Thank you. Now, if I heard you right, you asked who is considered essential.
Yes.
Okay, and this is spelled out very clearly in the guidelines that were issued by the city of New Orleans on Friday. So essential speaks to, one, whether it's your healthcare professionals, businesses that are essential in terms of your banks, your grocery stores, the restaurants that will do takeout, delivery, or pickup only, essential. Also, as it relates to your, I call it, I don't want to give a plug Home Depot, but it's like your, it's like your Home Depots. Got a free little plug, which is good. They're operating, right? They're operating in Orleans Parish also. But it's those essential establishments or businesses that we, the public, will need to depend on to live and also to operate, in our city.
So as of right now, all construction work is stopped unless it's by the city?
All construction work in Orleans Parish is not stopped as it relates to work being done by the city of New Orleans. So, for example, our infrastructure work, our joint infrastructure work with Sewage and Water Board and DPW, which also speaks to green infrastructure, those projects are not stopped. We need them to move forward. What we understand in this environment, it seems to align itself very well with the social distancing practices that are already in place. Also, the equipment that the contractors would wear when doing the work. And so this particular environment doesn't call for, as far as Orleans Parish, to stop this type of infrastructure work. We know that hurricane season, June, and that's for all of us. But as it relates to Orleans, and with the amount of infrastructure work that we've had to put on the street for 2020, we need that work to move forward, because a lot of it is also tied to federal dollars that are on deadline. And I don't want to get into a situation to where these dollars go away, but the need for infrastructure continues to remain the same. So we're in this predicament simply because resources were not spent or projects were not delivered in a timely manner through the years. But under my administration, we move this work, and it will continue to move forward, because it does speak to the immediate needs and conditions of infrastructure in the city of New Orleans. Our focus has been on our most vulnerable, and that also speaks to our nursing homes, but also independent living facilities that oftentimes get left out even when talking about it. Guidelines have been disseminated for our assisted living, as well as, of course, our nursing homes. We had one nursing home that that was just inundated, and you know what that one is, Lambeth. We have no other areas, even assisted living facilities, that have been consistent what we've seen with Lambeth. So we believe that we have been able to isolate that and continuing to do everything possible to focus on Lambeth, but also as it relates to guidelines for other assisted living facilities and nursing homes to follow. We touch them daily, and we are seeing, because we have to be the eyes on that to make sure that they're following proper protocols and procedures, because we do not want what we saw after Katrina to happen as it relates to our most vulnerable people, because it's something that me and my team have been working on just daily, but even today, working to take further steps. what we know and what we have seen as it relates to our street homeless. That's the focus right now. Our homeless individuals that are in our shelters, really doing the assessments that are necessary to move them into housing. So there are partners associated with that. But my focus primarily has been on street homeless. With the shutdown, meaning in regards to the stay-at-home orders and even those that came prior to that, with limiting operations of businesses, particularly restaurants, for example, minimal operations, or even those that have closed down, including bars closed down. What we have seen that these practices, it's driving our rodents crazy. And what rodents do, they will find food, they will find water. That puts our street homeless in dire straits. And then that's why I'm just laser focused on it right now. Moving our people off the street. We have about 90 on the street. I'm asking, and I'll be relocating about 120. You have to break it down into size. So although our numbers are showing 90, I'm planning for 120. I need them off the street, and so we're working on where they will go, but also making sure that they're provided resources and services that they will need. But as I look at how the rodents are being driven crazy, how they will then go to these encampments, I do not in any way want Titus. We don't have it in Orleans, and we do not want it. So it means being more proactive in this regard. We're in the height of mosquito season, right? So that's another issue. We know that we have had cases of West Nile in neighboring parishes. We do not want that. As it relates to our street homeless, it makes them even more vulnerable. So with this population, we're moving. I've given my directives. I want my people off the street, and we're working towards that, and hopefully be able to show you results tied to that by tomorrow as well as Tuesday. But the logistics have to be worked out first, so then when we move, then we not only move, but it's the way that we expect things to go will be seamless. And that's a part of this. We have to stay calm, stay focused on the mission, execute, and also see that we've done the right thing.